as I said, the whole point of the BORS meeting is about us addressing the concerns that you have as individual units and how we can support what's going on. Also for us to learn from different best practice and patient safety and other quality improvement initiatives that you're undertaking. So this part of the meeting is about just hearing from you any questions you have and what we can do more to help support what's going on in your units. There will be some questions maybe online, but for any of you in the auditorium today, do you have any questions that you'd like to put forward?
I'm Noah Alata from Glasgow. One of the questions I want to bring up from our centre is funding for prehabilitation. I'm sure like others, we've looked into frailty and how we manage this, but that funding now is being withdrawn, and I wonder what the society is doing to help in that field. Thank you.
Yeah, as you'll have heard from the two research presentations earlier, both in thoracic and cardiac surgery, the importance of that is stressed. We're also trying to get it done through ERAS and support getting individual funding locally. I'm not sure it's something I can specifically comment on, but what we're trying to do in the society is to show the importance of that for the patients, that we can improve patient outcomes, but also reduce hospital length of stay. So I'd be happy to have further contact with you to try and help support that process. But in terms of local funding, I'm sure that is a challenge that we all have individually. So, Elizabeth.
Thanks. I'm Elizabeth Belcher, consultant thoracic surgeon from Oxford. Thank you for all the work that the executive is doing to plan for the expansion in thoracic work. And I noticed your slide, Narain, where you had increased efficiency and increased capacity. And what I would say is I think the thoracic units around the country have, over the last 10 years, worked incredibly hard to increase their efficiency. We have all adopted day of surgery models and enhanced recovery. And I think the idea that we can absorb something between 30 and 100% increase in primary lung cancer operations by just further reductions in efficiency is not going to be possible. And also just on your slides there, Narain, on the left-hand side, you had campaigning for ring fencing for ITU beds, but in thoracic surgery, most of us rarely use intensive care beds now, and we really need ring fencing of all levels of cardiothoracic beds if that's going to help us in thoracic surgery.
I share your comments. It's a challenge when we have these discussions with NHS England about how we're going to achieve this. Some of it requires funding, some of it requires staffing and infrastructure changes. The simple concept of saying, yep, we need double our thoracic surgeon capacity, they've got to have somewhere to operate and clinic space. We have all those challenges locally, and it's about putting the whole package of care in. So thank you. Steve.
Steve Billing from Wolverhampton. I'm not actually a thoracic surgeon, but looking with the manager's eyes, has there been any communication of the modelling of the likely thoracic surgery volumes to trust executives? Because the natural tendency for NHS managers is to react rather than proact. I do think that kind of data, if it hasn't gone, would be valuable. I think Aman would be able to answer.
Yeah. So, well, but the answer is it's gone repeatedly to, but it's just a question of prioritization and what is out there. I hope that before the end of the year, we will be able to get another meeting of all the stakeholders, Tim and others, to look at the workforce modelling again, and then we can certainly write to the chief executives of the thoracic surgery units, and so that it's higher up on their radar. Yeah, so that's the short answer. It's been out there quite a lot.
I think it's a challenge even for those of us on the cardiac side of it, because we'll be fighting for the same resources. So. Any other questions at all? Nothing else online. Emma, please.
Yeah, I'm getting my steps in on that.
Yeah. With respect to thoracic surgery, I think this is such a great opportunity for us if we work together, because it's a big political hot potato. You know, it was actually the Prime Minister that announced that we were going to have the rollout of lung cancer screening, and was you know, involved in that. And we have shown with lung volume reduction, with PECTUS, with other projects that are going on, we've shown that we as a community can do it. We've shown that we can do it with research. We've shown that we can do it with big data collection projects. And if we together produce a patient-focused service improvement plan or service specification, I think that we will lay the foundations for a fantastic decade ahead of us. But it's all about working together. So, you know, please pitch in.